Hello everybody, welcome to today's program. I am Dr. Naveen, Narendranath, your favorite ophthalmologist, and today we are going to see a very interesting topic, rather common topic. I am sure a lot of you would benefit from this. Would you like to know what the topic is? Well, today we will talk about refractive errors. This is something that as ophthalmologists, as opticians, as optometrists, we use this term refractive error. But it's something that most people, they just say, refer to it as eye power. You'd be surprised to know that there are so many types of eye powers. So let's get into a little bit of detail. I'll just explain to you the various different types of eye powers and what that would mean for the person who has them. Now, you would find this really interesting that almost all of us have some degree of refractive error. Sometimes the errors are so small that it's very difficult for us to even ascertain the extent of the power. But sometimes it's really gross and it's so much that person finds it difficult to see. Now, in common tongue we would call refractive errors, we would refer to them as short sight, long sight. Let me throw some light on that. So, when someone says that they are short sighted, so by definition we mean that they are able to see something that is close by, short, something nearby. So, they are able to see things that are close up without the need for glasses. However, when they look at things that are far away, they find it really difficult to see, everything is a blur. So, this is what we refer to as myopia. Myopia is also called short sightedness. Now, this is something that we are seeing an increasing incidence of almost every single day. The reason being that many of our kids nowadays, given the corona pandemic, they are forced to have these online classes, they are forced to have increased screen time, they have decreased outdoor activities, so on and so forth, and all this leads to the development of myopia. So, on the contrary, you have something called farsightedness or hypermetropia. So, hypermetropia refers to the ability of a person to see things that are far away a little bit more clearly than things that are nearby. So, when they have to look at, let us say, a textbook or the cell phone, they find it increasingly difficult to see and they need a special corrective glasses for that. So, this is called hypermetropia. We have another condition that is called astigmatism, which is a little bit unique in the sense that the light rays that come into the eye, it sort of gets skewed. One set of rays gets focused earlier than another set of rays. So, this is what is called as astigmatism. So, basically refractive errors are errors of the visual system where light, when it falls on the eye, it does not bring the light to a point focus on the retina. Now, you must understand that light, when it hits the eye, it passes through the cornea, through the aqueous humor, which is a liquid which is inside, then it passes through the lens, then it passes through the vitreous humor, and then finally reaches the retina, where it is converted into electrical impulses and then sent to the brain. So, although we take sight for granted, there is so much that is actually happening. Light has to pass through so many different structures within the eye. And ultimately, it has to form a point focus on the retina. So, when it does not form a point focus, that is what we refer to as refractive error. So, as I mentioned earlier, I just spoke about myopia and hypermetropia. So, in myopia, what happens is the light gets focused in front of the retina. It does not get focused on the retina, but it is actually getting focused in front of the retina. In hypermetropia, what happens is the light gets focused behind the retina, and in astigmatism there is splitting up of light. So, some gets focused in front, some gets focused behind, sometimes the two portions are focused in front and behind. So, when this happens, we have various combinations of refractive error. We call them as a compound myopic astigmatism or simple myopic astigmatism. I think if I go into too much detail, I think it's going to be very difficult for us to understand what is really going on. So, I think it suffices to say that there are so many different types of refractive error. Now, did you know that there is something called antimetropia? Do you know what antimetropia is? Antimetropia refers to a condition where one eye has a plus power and one eye has a minus power. You know, it's not very common. Usually when we have a refractive error, we usually both eyes have more or less similar distribution of refractive error. It would usually be both would be minus or both would be plus, but it's a rare thing to find one eye having plus and one eye having minus. So, did you know that a single eye can also have both a plus power and a minus power? So, this is something that we call mixed astigmatism. There is also something called anisometropia. So, what this basically refers to is that sometimes one eye may be absolutely fine, absolutely normal, they can see everything, they can see 20/20, that is they can read the last line without any problem, and the other eye however would have a refractive error. Now, this problem is particularly difficult to diagnose because with both eyes open we do not really have a problem. Let us say the right eye is good and the left eye is blurred, with both eyes open the right eye dominates and you are still able to see everything. So, this type of an error usually comes to our notice very late. I have seen patients who come to me at the age of 18 or 20 and they would have just realized that while washing their face, and they would have just seen through one eye and noticed that they do not have good vision in that eye. Until then they would not have even realized that they actually have this type of defect, when in fact this would have been something that has been there for many years. Unfortunately, for things like this, unless it is diagnosed, unless it is picked up early, it is very difficult to treat, because the eye which is not being used adequately becomes what we call lazy eye. It becomes amblyopic. This is the technical term that we use. So, what do I mean by amblyopia? What do I mean by lazy eye? Sometimes when I say lazy eye, my patients laugh. What, doctor? You are saying lazy eye and all. You know, it's not like that. See, what actually happens with lazy eye is that there is no problem with the eye itself. Okay, there is no cataract, there is no scar, there is no retinal problem, there is no nerve issue. The eye looks fine fundamentally, everything is good, the structures are all really healthy. So, what is going on? What is the problem? Why is that eye not able to see? So, what basically happens is we must go further along the visual pathway. What we must understand is that the eye is just a sensory organ, it receives the light, after which it is converted to electrical impulses and it goes to the brain. Now, the brain is something like a CPU which processes this information. Now, imagine the eye is not seeing anything very well. What happens then is that there is a lot of neural connections that are happening in the brain, a lot of complicated neuron to neuron anastomosis, a lot of nerve connections are developing. So, when an eye does not see well, naturally some of these connections do not develop adequately. More often than not, although we do not like to compare, sometimes the brain, it would prefer the image which comes from the good eye. Let us say the right eye is good, it would support the right eye and develop a lot of connections to the right eye, and because the left eye is blurred, it would sort of negate that and it would not invest in developing the connections for the left eye. So, when this happens, this is called suppression. The brain subconsciously is telling itself, look, I am not getting the desired image quality from one eye, I am going to shut it out for now, I am going to focus on the eye that is good, and I am going to put all my effort and energy into developing the right eye. So, this is what is lazy eye syndrome. So, the eye that does not get support from the brain, so it is not a problem at the level of the eye, it's a problem that is actually happening at the occipital cortex, which is actually way back over here, it is behind. You will be surprised to know that the eye is in front, but the connections go all the way to the back of the head. So, what this means for the patient is, so if the connections are less, despite wearing the right power, despite giving the right contact lens, despite getting the right refractive treatment, unless those connections in the brain develop, the eye will still not be able to see, the brain will still not be able to process the image. So even if they wear a glass, they would still not be able to read the last 4 or 5 lines. Now we take it for granted. You think that when you go to an optical shop or an ophthalmologist or to an eye hospital, you think that the moment you place a glass, you think that you would be able to see everything well, but that's not the case in lazy eye syndrome. So there is one very important test that I would like you to do right now. It's very simple. All you have to do is close one eye. Close one eye with the palm of your hand like this, and just have a look. Just look at your TV or look at something that's far off, or look at something that's near. See how clear it is. Look at the clarity of it. Now close the other eye and see if you're actually having the same kind of clarity, or if there is a loss of clarity. So when you're doing this, you can identify at home, without even coming to a hospital, you can identify this at home and see if there's actually a difference between the eyes. So when you have a difference between the eyes, it probably means you have some sort of a refractive error or some other minor issue. If you do have a difference, don't hesitate. Please go to a nearby ophthalmologist or an optical shop, optician, somebody, get the eyes tested and see if everything is okay inside. So I had just now mentioned about myopia and hypermetropia. Would you like to know how we treat these? So it's really simple. Our gold standard way of treating refractive error is by giving glasses. Now in most schools they have a screening program in place where they test the hearing, they test the vision and eyesight and everything. So usually myopia is something that's picked up quite easily. So how myopia is tested and how it's diagnosed? Well, the children are asked to read a bunch of letters from a chart that is placed about 6 meters away, and they are asked to read the last line. If they can read the last line, they do not have a refractive error, they do not have myopia, because they are able to see even the fine print that's far away. So they are not short sighted, they are perfectly normal. Such people are called emmetropes, that they are perfectly fine. However, on the other hand, diagnosing a hypermetrope is a little bit more difficult, because using the power of accommodation, sometimes these kids, they actually hide their actual power, you know. It's called a hidden power or a latent power. You'll be surprised to know what and all kids do these days. So glasses, basically they form the cornerstone for the treatment of any refractive error, be it myopia, hypermetropia or astigmatism. Glasses are the key. Now when we identify kids with problems like this, depending on the level or depending on their need for visual stimulation or their visual needs, we decide whether they need to be given glasses. Now why I am specifying this is because I see a lot of preterm babies. Now preterm babies generally also have a higher risk of developing these refractive errors. So these babies weigh 500, 600 grams, tiny babies. So when they come to me at around 6 months of age, we check for refractive errors. We see if these babies actually have a visual error or a refractive error or not, whether they have an imbalance between the eyes or not. And we have a criteria. Just because there is a small power, we don't start giving glasses for everybody. It depends on the visual need. For a child, if the child can see an apple, that's fine, they don't have to read fine print. However, if there's a kid who's going to the 3rd standard or 4th standard, then their visual needs increase drastically, because the font size of everything from the textbooks to what's written on the blackboard, everything tends to be a little bit smaller. It becomes that much more imperative that they are able to see those letters clearly. So when the visual demand increases, automatically the need for glasses would increase. So glasses basically form the basis, it is the basic thing that we actually give for person with refractive error. Now what about bigger kids? What about people who do not like to wear glasses? What do we do then? What are the alternatives? Well, contact lenses are a very good alternative. Why not? So there is this misconception that, you know, if you wear a glass, you look less attractive, and these are all humbug if you ask me. You know, sometimes I feel glasses actually add to the person's personality. So it all depends on how you carry yourself. That I think goes a long way, because it's not just that you're wearing glass. No, you should never allow that to happen. In fact, if your kids are wearing glasses, as parents I would suggest that you give them the confidence that it takes, and show them there's so many eminent personalities who wear glasses, and that is not going to stop them from reaching their dreams or reaching their goals. That should never be that should never be a setback. Always it should be a positive approach. So contact lenses are for those people who find wearing glasses cumbersome or difficult, or they sweat a lot, the glasses keep slipping, or they find it very difficult to maintain the glasses, they break the glasses frequently, or they have some kids in the house who break the glasses, sit on them, etc. So then contact lenses are a big support, a big help. So when we talk about contact lenses, you'll be surprised to know there are many different types of contact lenses. We have contact lenses which we could use for a year, we have contact lenses which we could use for a month, and we have even daily disposable, fortnightly disposable, we have color contacts, other cosmetic contacts, bandage contact lenses, extended wear contact lenses. There's so many different types of contact lenses. But let me just tell you this one thing, that over a period of time we have shifted mostly from wearing annually disposable lenses, that is lenses which is changed once a year, to something that is changed every month. Now let me tell you why. Because annually disposable lenses, these lenses are thick, because they have to handle the daily wear and tear of taking the lens from the lens case, putting it in the eye, removing it. So this has to happen for 365 days. So these lenses tend to be a little thick. So when they are thick, they do not allow the oxygen to permeate through the lens. See, the contact lens is going to rest on the surface of the cornea, and cornea is an organ which receives nutrition from the air, it receives oxygen from the air. So imagine you are placing an artificial lens on your cornea. What do you think is going to happen? Do you think the cornea is going to get adequate air? Well, scientists have discovered materials and they have made contact lenses which allow oxygen to permeate through. But if we keep abusing the use of contact lenses, or we use it for more than the prescribed period of time, which more or less is the rule, most patients, I would say 80% or more, would wear contact lenses more than the prescribed time. Now if this is done for a few days, it is not really a problem. But if this is something that is going to be done consistently, then yes, we will have problems. So the problem with the annual contact lenses are that they are thicker, so they allow less oxygen to reach the cornea. Number two, because you are using it for a period of years, for a year, you would find that there are a lot of protein deposits on it. You can have a lot of infectious foci, that is, you can have some areas where you have some aggregates of bacteria sitting or hiding in the contact lens. So this can basically increase the chance of corneal eye infections. So this is the biggest setback for annually disposable lenses, which is why more or less most of us have shifted to the much more safer monthly disposable lenses. Now these lenses offer the advantage that they are thinner, they do not have to be used 365 days. So these lenses are designed to be much thinner, and so they allow a lot more oxygen to permeate, go through and reach the cornea. You can wear these lenses for a little bit longer as well, and you do not have to worry about the protein deposits or bacteria, because you are anyway going to dispose it off after a month. And so if you have a decent hygiene and if you are able to maintain your contact lens reasonably well, I think monthly disposable contact lenses are the way to go. I did touch upon the daily disposable lenses. Now daily disposable lenses is not something that I would really recommend for the average person. And why? Because can you imagine having 30 sets of lenses for a month? No, it is not practically possible, but there are people who use this. For example, air hostesses, models, actors. So they have to keep moving, here and there, they need to have like so many different, they need to take off their contacts, change their contacts, they go to different places, they are in different cities. So, you know, they can't be relying on one set of contact lens. If one gets lost, they always have another. So, this daily disposable is something that is for a niche group of people who would find the daily disposable lenses are a lot more suitable for their lifestyle. Of course, besides this, we have special kinds of contact lenses specific for certain eye conditions. If the cornea is weak, if there is a condition called keratoconus, then we have special lenses like row scale lenses which we can give. Doctor, I have had enough. I have worn glasses for 20 years, I have worn contact lens for 10 years, I'm not happy, I don't want to wear glasses, I don't want to depend on anything, doctor. Is there anything more that you can do for my refractive error? Well, yes, we can certainly do. There is something called refractive laser procedures which we do. I'm not calling it LASIK, I'm not calling it SMILE, I'm not calling it trans-PRK. All this comes under the gamut of refractive laser procedures. So, what we do with these procedures is that we basically correct the shape of the cornea so that it works. We either strengthen the cornea by giving it more of a plus power, or we weaken the cornea by giving it more of a minus power. So, this is possible through different techniques. There are so many different techniques. See, not all corneas are the same. So, refractive procedure may not be suitable for everybody. So, before we do a refractive procedure, we do a thorough evaluation. We ensure there is no scar on the cornea, we ensure the cornea is of the right shape. Why I am focusing on the cornea is because most of the laser procedures we do is on the cornea. So, the cornea needs to be absolutely healthy. The corneal shape has to be perfectly fine. We should not have a lot of aberrations in the cornea. The cornea needs to have a certain thickness, because we are at some points we are going to shave off some micron thickness of the cornea. So, if the cornea is already thin to begin with, or there is an abnormality in the corneal shape, or if there are a lot of higher order aberrations, then it becomes a little bit more tricky, a little bit more difficult. And in such cases, our options also become a little bit more restricted. So, when we have a good thickness of cornea, normally the cornea on an average measures somewhere between 535 to 555 microns. So, when the cornea is good, when it is healthy, that is one of the factors that we look for. The second factor that we look for is the stabilization of power. Now, many kids, when they are 12, 14, the parents come to me and say, doctor, when can we do the laser treatment? Age is not really a factor. Normally, although we do say come at the age of 18 or 20, more than the age, it is actually the stabilization of power that is what we are looking for. Because when the power is stable, it is possible for us to do an even better job and ensure that the power does not recur. So, instead of being hasty and getting the procedure done before there is stabilization of power, I urge you all to just wait for that little more time and then go ahead and do the procedure. So, my average age at which I do the procedure is around 24 to 25 years. So, I don't rush and do it at the age of 18, because for me patient satisfaction is most important. I mean, what is the point of doing the procedure when the power has not stabilized, only to have the power recur. So, I always wait for at least a year or two for the power to stabilize and then go ahead and do the procedure. So, there are, as I mentioned, there are so many different types of procedures that we do. A trans-PRK is a special procedure. I would like to add a special note for this. You must have heard about LASIK, you must have heard about SMILE. Trans-PRK is a wonderful procedure. Let me tell you why. It's great, because there is no flap. This procedure is potentially repeatable. So, let us say for some chance you actually get you have a power, you already had a procedure done elsewhere, you still have a power, why not you can get it treated, because we are not going to do any flap. It is a fantastic procedure. It is bladeless, there is no blade that is used, and this is one of those procedures that is actually hands free. I do not really have to do anything, the laser machine does everything. All I need to do is to ensure that the eye is well centered, that's about it. So it's a simple procedure which just takes about 40 to 50 seconds, and before you know it, you have excellent vision. Recovery for this would take a day or two, and it's fantastic. So technology has changed so much these days. There's no need to scrape the cornea, remove the epithelium. No, trans-PRK is a fantastic procedure. So do go to your ophthalmologist, do consult. If you did that exercise that I asked you to do, and if you have an error, do go to your ophthalmologist, do consult with them, see what's the best approach. If glasses is what is being prescribed, please get a pair of glasses, or if it's contact lenses, please wear your glasses regularly. Glasses are not usually given to be worn just when you're studying or when you're watching TV. Usually glasses are prescribed for regular use, that's for constant wear. So my dear viewers, I hope you found this episode really beneficial. I thought that it would be fit to talk about a topic that is applicable to most of us, and that's why I covered this topic of refractive errors. So please wear your glasses regularly, and please maintain your contact lenses well, and please ask your doctor if you are suitable for a refractive procedure, because we can get rid of your glasses or contact lenses in one shot. So I think this is fantastic times now, and I hope you really have a great day. If you are one of those viewers and you have found that you actually have a refractive error, please don't hesitate, get your eye checked up immediately, go to a nearby ophthalmologist or an optical shop. They will do the needful, and they will guide you, and they will ensure that you get the best for your eyes. I hope you found this useful. So have a fantastic day, and thank you so much.